Hi, how are you?
I'm good. How are you?
I'm well. So today I'm going to talk to you about different hormonal birth control methods and how they impact your body. And then I'm also going to discuss proper administration of birth control, of these birth control methods. And just so that you can have the knowledge so that your whatever method you choose can be effective, okay?
Okay.
So first, I would like to gather some background information. Are you or have you been on birth control before? Let me ask that.
No.
No. Okay, so this is your first time. So you're making a important lifestyle change, and it's really important that you find a method that works best for you. Um, and are you a smoker?
No.
No. Okay, that's good. And then I guess can you tell me a little bit about any conditions that you might have?
I have PCOS and I have asthma, but that's it.
Okay. And when were you diagnosed with PCOS?
A month ago during my
I'm sorry, you were breaking up.
a
When?
month ago.
A month ago? Okay. Did your doctor recommend that you start birth control to manage your PCOS?
Yes, but I didn't know very much information about it, so I wasn't really too open to starting it.
Okay. Okay. So what we're going to do now is we're going to do a tool. It's pretty much for you to reflect just to see how ready you are to make this type of lifestyle change. The name of this tool is called the ruler method of change. It's pretty much like on a scale of 1 to 10, like how do you feel about this? Or I'll just ask you a series of questions. So we can get started with that, and then that way I can assess what stage of change you are at. Okay. So on a scale of
Okay.
1 to 10, where do you think you are in starting birth control? 10 being like, yes, I'm ready, like I can go right now and start right now, or 1 being like, not
Nine.
really. You're at a
I
9.
say a nine.
Okay. And then how much do you want this new lifestyle, I would say, on a scale of 1 to 10?
10.
10? Okay. And then still on a scale of 1 to 10, how ready are you to make a change?
Nine.
9? Okay. And then how confident are you to make this change?
10.
Okay. And then you said that for your readiness of change, you stated that it was a 9. What could make that be a 10?
More information
Okay. And
and to
that
be a little more self-aware of
okay.
what I'm walking into.
Okay. Okay. And that's what I can do for you today. Sounds like you are just trying to get prepared, making some goals, seeking more information. Um, and basically, too, what this tool was for is just for you to kind of self-reflect to see where you're at. Because as I stated before, this is a lifestyle change, and although there are different methods, each method doesn't work for each person. You know what I mean?
Yes.
So I'm going to start talking about different forms of methods. If you have any questions, like stop me and just ask right away, okay? Um,
Okay.
so first I'm going to talk about the pill. So there are two types of pills. There are combination pills, and there are also progesterone only pills. So with both pills, they stop ovulation, which is the egg being released from your ovaries is going to stop that. And it's also going to thicken the cervical mucus, which will not allow sperm to pass through and therefore enter the uterus. Um, so with the
Okay.
combination pills, there you can't be a smoker and you can't be someone over 35, which is why I asked if you smoke, because that would be a, you know,
Okay.
that it wouldn't be good for you because it could lead to a lot of clots, um, like stroke, heart attack, and so forth, and that, that's very dangerous. Um, but with the progestin
Oh.
only pill, we also call it the mini pill. That's really good for breastfeeding mothers. Um, and it pretty much does the same thing as far as how your body will react to it, if you were not a smoker, of course. um, it would do the same thing, but it's just for women who breastfeed. um, and then also too, with both of these pills, you want to take one pill each day for a month. Okay.
Okay.
So yeah. So whether you have to set a timer in your phone or uh, you know, maybe like log it on your period app or something like that, just so you can be a little bit more mindful. But especially with the progestin only, it's very important for you to take that pill at the same time every day. Okay. Um, and let's see.
Yeah.
Do you have
And I'm sorry, do any of these pills help with acne?
do any of these pills help with acne? Um, I believe that they can because it is a hormonal pill. I can ask the doctor for further information about that. And I'm also going to provide a pamphlet to go into more details. But I would definitely talk to the doctor about that. Maybe different brands could be a little bit more effective about acne.
Okay.
Since that is a concern of yours, I will make that a priority to get back to you. Okay.
Okay.
Okay. And let's see. We talked about the pill. And now we're going to talk about the vaginal ring. So the vaginal ring or the NuvaRing, it's a disc or like a circle, maybe about like that big, and you insert it into your vagina for 3 weeks, and then you take it out 1 week. And
Okay.
during the week that the ring is out, that's when you have your period. It's best for this it's best for this birth control, the unused packages, to be stored in your refrigerator. And what this form of birth control does, it stops ovulation and it also thickens the cervical mucus to block sperm from passing through. Um, and do you? Oh yeah, it's also a combination, so it's estrogen and progesterone. Do you have any questions about that?
No.
Okay. So next we have the transdermal patch. It's a very small patch that you just put on your skin. You could put it on your stomach, your upper arm, your back, or your buttocks. And it tends to be less effective for women who are over 198 pounds. With this method, it is a combination as well. So it has the estrogen and progesterone in there, and it stops ovulation, and it also thickens the cervical mucus.
Okay.
So with this one, you have to store the unused patches in a cool, dry place. So not the refrigerator like the NuvaRing, but you can just like leave it in your cabinet or something like that. And you want to change this birth control, or you want to change your patch out weekly. Okay. So
Okay.
next, we're going to talk about the implant. The implant is a progesterone only. It's a long acting reversible contraceptive method. That means that this will not allow you to get pregnant. It's very effective. It won't allow you to get pregnant while you're on it or while you have it in you. But as soon as you remove it, you are able to get pregnant. So a lot of people think that because they have something like the implant, because the implant, it lasts for once you insert it or once the doctor or nurse inserts it, it can last for 3 years. Um, And with this one, the doctor, it will make, he or she will make a cut into your arm. It's a very small cut, and they will insert a thin single rod in there, and then it will release progesterone. Okay. Now, like I said,
Okay.
this could last for 3 years or 5 years, depending. And it thickens the cervical mucus, and it also stops ovulation. Um, but the only thing about the implant is that it could lead to weight gain, and it could decrease bone density. Um, and please be mindful too.
Oh,
Oh, do you have a question?
weight gain. So, out of all the birth controls, would you say this one is more so for weight gain instead of the?
I'm sorry, I didn't hear the last part. You were breaking up on my end.
You said this one is for weight gain. The pill, the implant.
Yeah, so this the implant, it can lead to weight gain.
Okay.
Yes. This one can lead to weight gain. And also I'm going to talk about this or the next one in a little bit, but the depot shot, or the shot as people call it, can also lead to weight gain. Okay. Um, let's see a little bit more
Okay.
about the implant. That's pretty much it. Do you have any more questions?
No, you answered it. Since you said weight gain, that was one of my main questions and
Okay.
concerns.
Okay. Um, so also too, like I said, if you decide to get the implant and you decide that you no longer want it, you could just make an appointment with your doctor and you can have it removed. Okay. So next we're going to talk about the injectable or the depot shot or
Okay.
the shot. So it's progesterone only birth control. It is also a long acting reversible contraceptive, meaning that you will not get pregnant, of course, if you get your shot regularly and you follow the proper protocols for it. You will not get pregnant, but as soon as you get off, you could become pregnant. So it's reversible. Okay. So you would get a shot 12 weeks, every 12 weeks, and the shot it's intramuscular. So we're talking about the deltoid here, or like the thighs, like something that's, or an area that's has muscle, versus like, um,
Okay.
versus your stomach where that's more fatty, or like the back of your arm is more fatty. The depot shot, you want it intramuscular. Okay. Um, so this method can also lead to weight gain, and can also lead
Okay.
to increase in bone density. And then also too, with this method, you tend to have a little bit more painful periods. Okay.
Oh, okay. So you do get your period on this.
You do get your period on this. Yeah.
Okay.
Yes. Um, but they just tend to be a little bit more painful. Okay. Um, so with this method, it's ovulation does not occur. And then also to the cervical mucus thickens to also block sperm. Your doctor or nurse can give you an injection. So every 12 weeks, if you want to go get your shot by your doctor, you can do that. But you can also give yourself your own injection at home, if that's something that you would want to do. Do you have any
Nothing.
questions?
No.
No? Okay. So the last method I wanted to discuss with you is the intrauterine device, or the IUD. It's two methods. One is not hormonal. It's copper. And this copper is, well, first off, the IUD is shaped like a T, okay? And it's entered through the vagina, through the cervix, and it goes into your uterus, okay? Um, and it's the most effective birth control. We have the copper, which is lined with copper, and sperm does not like copper. So as soon as sperm enters that area or the uterus with the copper IUD, they pretty much will be destroyed. And then also
Okay.
too, we have the hormonal IUD, which thickens the cervical mucus and stops ovulation. The copper IUD, it can last for 10 years. It's crazy. And the hormonal IUD, it lasts between 5 to 7 years, depending on what brand you get. Okay. So a doctor has to insert it, and if you decide you don't want it anymore, you can always have it taken out. Okay. Um, so there's also a risk of your ID or IUD.
So I don't have to worry about this.
I'm sorry.
I have a question.
Hmm.
I don't have to worry about this one like falling out or anything. Like it's pretty secured in there, correct?
That's what I
Because
was.
it's more like a surgical procedure.
That's what I was going to get to.
Okay.
So the risk with IUDs is the fact that it can puncture your uterus, and it can
Okay.
also I'm sorry, it can also fall out when you have your period. So every time you have your period, it's very important that you check to make sure that the strings are still there. Okay.
Okay.
Um, do you have any questions about the IUD? And
You
also,
said that there's strings.
yes. I'm actually
Okay.
going to show you a video in a few minutes, okay? Just so you can see like the proper insertion and such. Okay. So do you oh yes, I was also going to say. The IUD, both methods are long-acting reversible contraceptives, meaning that, like I said earlier, like when you're on it, you cannot get pregnant because it's just that effective when used properly. But if you decide to take it out, your body will go back to normal and you will be able to get pregnant. Okay. So, as I
Okay.
said earlier, is the email that you have on file with us, is that still correct? Is that okay to use?
Yes.
Okay. So I am going to email a pamphlet. I'm going to show you too, but I'm also going to email a pamphlet, a pamphlet to you. Um, let's see. Okay, I'm going to share my screen so that also too, I forgot to mention this earlier, and just circling back with the birth control pill, because I know that it happens, because I know that you have a busy lifestyle. I know that you're in grad school and that you work a full-time job. So if you miss a pill, um, just as soon as you remember, take the pill right away. But Planned Parenthood, they have a nice little tool now where if you miss a pill, they'll give you instructions. If you put in the brand and everything else like that, they'll give you instructions on what to do next. And if you still feel uneasy about that, you can always just call the doctor's office and
Yeah.
talk to a nurse or talk to your primary care. Okay. That was something that was really important that I wanted to touch on as well. Okay.
Okay.
So I'm going to actually show you here. Let me share my screen. Okay. Okay, sorry, this is taking, okay, sorry.
No, you're fine.
Are you able to see my screen?
Yes.
Okay, so here is the Planned Parenthood little tool. Like I said, it's like a quiz. So you can say take quiz, and then you'll enter in all your information, your age, and such forth. Let's see. I'll put let's do, okay. And then you could say like, oh, like I forgot my pill yesterday. And then
Okay.
here's a list of all the birth control pills that they have. And if you just click one, um, they'll be able to tell you. Okay.
Okay.
So here's a video. Um, And it's pretty much just talking about the effectiveness of each birth control method. It's very short, it's about 2 minutes, okay?
Hormonal methods. These methods involve two hormones that regulate the reproductive cycle, estrogen and progesterone. Hormonal contraceptives release either progestin and estrogen or progestin alone. Estrogen will prevent the release of an egg, so there's nothing to fertilize. Progestin will cause the uterine mucus to thicken and stop sperm from reaching the egg. Within this category, there are oral contraceptive pills, internal contraceptives, and transdermal contraceptives. It is important to note that no form of hormonal contraceptive will protect you against STIs. The first subtype is oral contraceptives. These include the combination pill and the mini pill. The combination pill contains both estrogen and progestin, while the mini pill contains only progestin. Both forms of oral contraceptives are 99.7% effective with perfect use and 92% effective with typical use. In order for either of these pills to be effective, they have to be taken at the same time each day. These pills are typically taken for 3 weeks and not taken for the 4th week. The second subtype is internal contraceptives. These include the intrauterine device and birth control rings. Intrauterine devices, also known as IUDs, are more than 99% effective with perfect use. They are T-shaped devices which are inserted into the uterus by a trained physician. There are two types of IUDs, hormonal and copper. Hormonal IUDs function by releasing progestin, while copper IUDs function by creating an inflammatory response in the cervix, which kills the sperm, and altering the cervical mucus to inhibit sperm motility. IUDs are reversible and can be used for up to 5 years for hormonal and 10 years for copper. Birth control rings are small, flexible rings that can be inserted into the vagina without a physician. They release estrogen and progestin and are kept in for 3 weeks and removed for the 4th. Birth control rings are 99.7% effective with perfect use and 92% effective in typical use. The third subtype is transdermal contraceptives, which includes the transdermal patch. The patch releases both estrogen and progestin and is applied every week for 3 weeks and left off for the 4th week. It is 99.7% effective with perfect use and 92% effective with typical use. Talk to your doctor to find out which hormonal birth control is the best for you. Emergency post-coital.
And then also too, I want to show you, if it lets me. Okay, there we go. Here's the pamphlet that I am going to send you. So from here, the implant on down to, let's see. So the shot are hormonal birth control methods that we talked about today. Okay. And it pretty much talks about, you know, what it is, or like how it's administered, and then how long it lasts, and any like side effects and stuff like that. It's very informational. Okay. And I'm going to email this to you too. Okay.
Okay, thank you.
Okay. Do you have any more questions for me?
Um, no, I just think I'm gonna make a kind of gearing towards the pills.
Mm-hmm.
I do have one little small question. None of these basically, like, I know that there's rumors that most of them cause infertility, but there's like no one that's 100% that will tell you like you're never gonna get pregnant after you take this one, right?
So no, there is no method that will cause infertility, like long-term infertility. No.
Okay, thank you.
Okay. If you have any more questions, please just call the doctor's office to speak to either me or one of the nurses or your primary care. Okay. Okay. Thank you so much.
Okay,
Have a good day.
you too. Thank you.